Hello guys, and welcome back to the next video of the Clinical Coder YouTube channel. Today I really want to kind of focus on AI in pharmacy. So last week I did a video of AI in healthcare in general, and today I really want to hone in on our niche, pharmacy. So first question is for you. Are you using AI in your daily practice? And if so, where? Drop in the comments below, I would love to hear from you. So AI in pharmacy, where is it being used right now? So let's start from the beginning of the pharmacy value chain, and that generally starts at drug discovery. So lots of pharma companies and lots of scientists are using tools like Google's AlphaFold, which basically has a database of loads of proteins, which allows you to be able to view these proteins, look at the active sites they fit in, and be able to assimilate lots of data to develop new drugs that may fit in certain active sites that you are interested in developing drugs for. That's one area. And then the next area is actually developing the side of digital clinical trials. Is very much in its infancy at the moment, but with the ability to be able to remotely monitor your patients once they've started their clinical trial, you can then take that data, process it through an AI algorithm, and be able to generate clear guidance on what to do next. If the data points are out of sync, if they're not, how is your patient reacting to that new drug? Is it a side effect? Is it not? It then pulls in more data points, which I think is a really interesting aspect of utilizing artificial intelligence in digital clinical trials. The next step, if we take a step forward, now we are in the pharmacy. So where is AI actually being used in retail pharmacy? One of the key areas, not just retail actually, in all the sectors, is through the PMR systems. So lots of pharmacies use PMR systems to process their prescriptions, process their stock, all of those kind of things. And now we have artificial intelligence, which is able to use machine learning to clinically check the prescriptions that pharmacists may have done prior. Lots of PMR systems are utilizing this tool now, whereby they can take a pharmacist can take a proportion, clinically check that, and feed that back into the system, whereby the machine learning algorithm can then take control and start to process these prescriptions that are commonly seen. Obviously, ones that are high risk and ones that are a little bit odd will definitely be flagged to the pharmacist. But it's exciting to see that this sort of releases the pharmacist to then focus on more clinical aspects of their care rather than doing the process things. The other place where AI is being used is in stock management. So stock management is obviously a really big thing, especially in pharmacies, especially globally, where we're starting to see a lot of stock issues. Stock management tools have the ability to kind of take in information where it's from, you know, what you've previously used, what your cohort of patients generally use, and give you the optimal time to order it so that you are optimizing your cost effectiveness in terms of buying. You're also being able to manage your patient cohort better. So those are the three main areas that I can think where AI is being used in pharmacy at the moment. Really short, sharp video. I'd love to hear your views on this and whether you come across any other AI tools. We mentioned some that also could be transferred to pharmacy in a previous video, which is AI tools in healthcare. Please watch that video if you haven't already. Don't forget to like and subscribe, and thank you for joining me today.